How you fix tendinitis depends on your body type. Now, I just did a series on what tendinitis is or why you have it, and I'm going to share with you how you can fix it. My name is Huang. I'm an occupational therapist and certified hand therapist here with hands-on therapy services located in Miami, Florida, and I treat various forms of tendinitis all the time. I treat them conservatively before they have surgery, to avoid surgery, and then I also treat them after the fact when people have ignored things for a long time and then they need surgery. So if you're somebody, you're trying to avoid surgery, injections, and all that good stuff, and like fix yourself, like for real, this video is going to be for you. And if you have any questions, definitely leave them below. But what is tendinitis? I just explained that in another video, so definitely go back and take a look at it. How you treat tendinitis is not the same for everybody. So this is why, even though I'm making videos like this, it's really comes from, I just want to educate you so you can understand a little bit more. So when you go to a therapy place to try to get some help, you have a better understanding of what it is, and you can go in and ask some really good questions. These are some of the things that my patients ask me. They're asking me like, why do I have this? And what do I need to do to fix this? And so kind of thinking like, how can I help to educate you so that you don't have to, wait so long to get help, or it just doesn't have to take you as long as it does. Majority of the time it takes so long because people tend to wait. I know because I myself, even though I'm a therapist, I myself had severe plantar fasciitis where I went and had an injection. I had to wear the boot. I had to get the orthotic. I had to change my shoes, like the works. And none of that shit worked for me. It also didn't work for me because my therapist, because when you're a therapist, other therapists think that you can just fix yourself, and you still need to go somewhere and get, and have someone else look at what's going on. It's the same analogy that I always use. Like when you're inside a jar, you can't read the outside label. So I can't always just miraculously fix myself. And that's why it's not always as easy for you to fix yourself, because you can't read the label when you're inside the jar. It's the same analogy as like surgeons don't do surgery to themselves. Like they go and get surgery somewhere else, right? But we're trying to avoid surgery. So let's talk about, I'll talk specifically about plantar fasciitis and also lateral epicondylitis in this video. If you want me to talk more about different various types of tendinitis, then leave me a comment below, because there's different problems. It's not that the treatment methodology is a little different, it's just the nuance of it, right? Because tendons are all the same. But here's what happens with your body type. So if you're a very hypomobile person or stiff as a board person, then tendinitis will essentially, you might lose some motion somewhere, right? So this happens to my patients who maybe they fell and they broke something, they didn't get all their motion back, and so they develop tendinitis because there's a muscle imbalance and they don't have enough motion. And so we need to increase the range of motion. I'm just gonna do my acronyms. Is to increase their range of motion. So we have to stretch them, right? We have to stretch them. And then we have to strengthen them. So this is very generic in nature. Strengthening isn't all over strengthening, and range of motion and stretching isn't just generic stretching. It's extremely important to know the direction of your stretch, right? In what direction do you stretch? You can't just always stretch. Like if it's my ankle, I have severe plantar fasciitis in my left leg. So the stretch against the wall to stretch your calves is the direction, the stretch, but also the location. Where do I stretch? It's not always what you think it is. It depends on where your particular problem is. And then your strength isn't necessarily overall strength. You have to be specific with which groups of muscles do you strengthen first, second, and third, and then it will get better. So I'm going to speak specifically on plantar fasciitis here, just because I myself had it, and if I could go back in time, I would do it differently. Because what I had, again, I had the injection. I had the injection after I had been dealing with months. So what I was told was stretch your calves. They were like, do the wall stretches, stretch out your calves, and do the toe curl stuff, like those exercises. Use ultrasound, use e-stem, massage that muscle. And because I did all of that ice massage, right? I actually love ice massaging, but it's very difficult to do because that shit hurts, right? It's very uncomfortable. So I did all of that, and then it didn't help me because I was constantly walking, right? Because you can't stop doing what you're doing. So you're constantly walking every day, and then you're doing all these stretches, and it actually didn't help me. So because it didn't help me, I went to the doctor and I was like, hey doctor, I have this foot problem. I'm like, and then he was like, oh, let me give you an injection, wear this boot. So I had to buy this boot that I had to wear every night, but they didn't tell me how long I needed to wear it. And then they told me I needed to get measured for an orthotic, got measured for that, put that shit in my shoe, didn't work, none of that worked. And I still continued to have pain. So how I treat it now is so different than how I was treated back then. And it's because it didn't work, right? So number one, your shoes. Shoes matter, right? Shoes matter. Get good shoes. Don't be cheap. Get good shoes. You need a little bit of support. Try them out, and then also wear different shoes throughout the week. So one of my bad habits is I like to wear the same shoe over and over for work. But you actually need a few pairs of shoes, and you switch it out throughout. But get good shoes, because it's one of the things that causes the problems, right? And then one of the things when it comes to getting range of motion, I'm a very loosey-goosey person. So this example is going to be like for me to you if you're a loosey-goosey person. What do I mean by loosey-goosey? You have a lot of motion. I have a lot of motion at my MPs. I have a lot of motion at my elbow, and I have a lot of motion at my knee. So my knee actually goes, like this. You see how this goes beyond zero, right? So it's not like here, it goes all the way back. My knee does the same exact thing, right? Let me see. I have big pants on right now, so when I wear my tight jeans, I'll give you an example of like how hypermobile I am. But stretching didn't help, and it was because we were stretching just my calves. So when we think about direction, it's important to find out where you have those muscle imbalances, right? And it's not always at your foot. Sometimes the location, I actually needed to stretch out my hips, right? So I was losing some motion in my hip. So there's different ways in which you can stretch it. It just depends on the person. So you can stretch it where you're bringing your knees up to you, so you can stretch the back part of your hip. Now, some people might need the hip extension, meaning you have to bring your hip back. So there's different ways to stretch that, but it's called hip extension. And then your hips also rotate, right? So I'm going to show you with my arms, but this is a certain type of rotation in the shoulder, internal, external rotation, internal rotation. Well, your hip has that same thing. So let me see if I can move my camera a little bit. I'll show you. Right? So this is rotation, right? If you put your hand on your hip right here, you can feel when you go out like this, you have rotation of your hip, right? This is internal, this is external. I hope I said that correctly. I'm sure somebody, but anyway, your hip rotates. And so what happens is you have to find where your limitations are, because your hip directly affects your knee, that directly affects your foot. So the whole chain, right, affects how your feet move. And so if you're only treating your foot, then we can't get rid of the problem. And so that was one of my biggest mistakes when I was early in my career and I had that problem. Every therapist that I worked with were just like, oh, let me, you have to massage your foot. And nobody wants to massage anybody's feet. So they're like, you do it. You do it, Juan. Like, so it feels good, but it doesn't fix the problem. So we will actually want to look at location of direction, but we will also want to look at where we're stretching, right? So if you stretch your hip, which then eventually will help you with the muscles that go to your knee, that then the muscles that go to your feet are actually, the muscles that go to your feet start in your knee. So, and the muscles that go to your knee start in your hip. So it's a chain effect, right? So you gotta get the range of motion. You're probably missing something up above where the problem is. And then we gotta strengthen, right? So where do we strengthen? So I'm working with one of my patients who has plantar fasciitis, he had, because now he's better. But we started in the hip, and then we started to strengthen his hips, and that helped to fix his foot. So we start at the hip, and we get the hip stronger, and then we do some exercises for the knee, not really the knee, but it's really for the foot and ankle, and those muscles are at the knee. So I have to describe this to my patients all the time because I don't want them to think that I'm not helping them, but it starts up here, and what we do is we'll strengthen the hip, and we'll see if the foot feels better. That's how we check to see, does therapy work? And it works when you are treating the right places. It doesn't work when you're just stretching or just spot treating. So that's why I always say when it comes to tendinitises, you can't just spot treat. Like wherever it hurts, it's the irritated part, but that doesn't mean that that's the only part and the why, the root cause of it. So we started strengthening his hip. So the group of muscles that we start to strengthen might be the hip rotators. So we're doing rotations of the hip, we're doing hip extension exercises, we're working the butt muscles, the glute muscles. So we're working those groups of muscles, and then once that gets better, then we can go to the feet and then work the feet better. So we kind of go back and forth. So that's how we work the plantar fasciitis. Now, when it comes to lateral epicondylitis, let's go up to lateral epicondylitis because it's really essentially the same, right? So I'm a very loosey-goosey person. I developed lateral epicondylitis in my right elbow from writing so much. So I changed positions when I was working at the hospital as an occupational therapist. I went from walking all day to being in a small outpatient setting, and so I didn't have to walk that much. But I was using my arms. I was stretching out really stiff fingers. I was stretching out really stiff shoulders, and then I had to write all day. Back in the day, this is how old I was. This is how old I am. Back in the day, we had to write our notes on paper that was carbon copy. It had 3 layers: a white copy, a yellow copy, and a pink copy, and you had to press down really hard so that it would copy down to those layers, and then we would pull them apart. Who here knows what I'm talking about? If you're old enough to know what I'm talking about, give me a holler. Say I know what you're talking about, Huang. So you have to write, you couldn't use a fancy gel pens, you had to write with ballpoint pen, and you had to press really hard. It killed my elbow, and so I spent all the time stretching. Turns out it wasn't my elbow that was hurting, right? So I didn't need to, so here where you would change your shoes, I had to change my pen. So you see the tendinitis, the problem is the same. Muscles are the same no matter where it is. Muscles get long and get short. Muscles are attached to tendons on each end that then are attached to bone. That is just muscle. That's anatomy. You came like that. I came like this. This is how we were created. I didn't do any of that. We can't change that. That's how we were created, right? And that's how we are able to function. However, what we can change is how we're using it. So when it came to writing, I had to change my pen. I was using a gel pen because I love me a gel pen. So I was using, writing on one page. I had to switch to a ballpoint pen because I had to press down, right? So I'm sitting there, right? Oh my God, it was killing me. So change your pens if you're writing. So now, who does carbon copy anymore? If you're writing with a ballpoint pen, you might need to change to a gel pen so you can write easier. You might not. You might have a death grip on your pen, right? Which is probably causing your tendinitis. Death grip on it. So you can change how you hold your pen. They sell fancy pens that are like a Y pen, so you can put it into your fingers. I love the pens that I use. I want to be able to use whatever pen. So all you have to do is change the position. So just put the pen in between your index finger and your long finger, and then you can write it like this, right? So in a foot, you change your shoe. In a lateral epicondylitis, you might just need to change your pen, right? You're still doing the same thing. We're still working on getting range of motion, right? So I'm a loosey-goosey person. I'm very hypermobile. So stretching might feel good in the moment, but what was happening was causing me a lot of pain later. And the funny thing with a lateral epicondylitis, and most people don't tell you, is we have a nerve that comes here and it goes right here. So if you've tried the little cuffs, stopping the movement, shortening the movement, sometimes you can press on that nerve and irritate that nerve more. How do you know? It's because it feels good when you have it on and it hurts when you take it off. If it works for you, you should have relief when you take it off. Most people are wearing their cuffs, those little air braces. Most people are wearing it incorrectly. Most people are wearing it way too long. Most people are wearing it when they don't need to wear it because that's not where the problem is, right? So let's look at our motion. So elbow problems, we can sit here and we can stretch it here and get it long, but then we're irritating that tendon again over and over. What if we shorten it, right? So you can shorten it this way and stretch this part and shorten here, but this again, some people, look at how much motion I have in my elbow. If I don't control how much motion in my elbow I have, I really can't get a really great stretch. And it's because my body is compensating. Your body might be compensating. So the direction of your stretch is going to be really important, and your location. So 2 places I always look above and below. If the elbow is in the middle, right, here is my elbow, the location that I'm looking at to work is above and below my elbow. I'm going to look at your hand and wrist. I'm going to look at your shoulder and neck, right? We've got to look at location. Where is your problem? Majority of the time, the problem is in the shoulder. Your shoulder blade's not moving. You don't have enough range of motion in your shoulder. It looks like you have motion, but that's because your shoulder blade is helping you look like you have a lot of motion. If I pinned you down, and I promise you, when you come to my clinic and I pin you down, you'll have lost motion at your shoulder level. And you'll have lost motion maybe in your turning of your palm up and palm down. That plays a role in your elbow pain. I don't know, because I can't see you. I don't know your history. I don't know your story. I cannot give personalized medical advice over the internet. This is just educational purposes. Go to your therapist, find out what's wrong, have them look above and below. That's what we do here at the clinic. We look above and below. If you're in Miami, I can help you come to the clinic. If you're not in Miami, I can still help you. We can do a consult, telehealth consult, and I can give you some directionality around what might be going on. But above and below, look at the location. Stretching only at the elbow. When you're spot treating for tendinitis, spot treatment for tendinitis does not work. That's why you still have pain. That's why none of the other shit that you're doing helps. That's why the TENS doesn't help. That's why the ultrasound doesn't help. That's why you're putting creams and massages doesn't help. And then you're going in and getting injections and it doesn't help. And it's because that's not why your root cause, right? So look and make sure you're getting the range of motion where you need to be getting the range of motion. Now, when it comes to strengthening, which group of muscles do we need to work? A lot of bicep curls, a lot of wrist curls don't help because, again, you're just spot treating, right? So that never helped me. Doing wrist curls, oh my God, hated those things. I never do those. My patients will tell you, I never do wrist curls. And I teach this stuff to other therapists. I never do wrist curls. If you're sitting here doing wrist curls, by all means, go ahead, right? If you like them, do them. But at the end of the day, they don't really fully help you with your tendinitis pain. Once you get rid of your tendinitis pain, you can do all the wrist curls you want, right? But the strengthening the group of muscles actually can start in your shoulder, right? Strengthen your rotator cuff muscles, make sure your scapula, your shoulder blades moving, and then you can go and strengthen your elbow and your hand, right? Key thing when it comes to tendinitis, treating tendinitis, is don't do things that will then irritate the tendon. So if you're doing exercises, you should not feel sharpness of pain while you're doing those exercises. You should not feel pain afterwards. You should not feel fatigue. Like, there's a very particular sensation of fatigue or heaviness that is not associated with working your muscles. They are two completely different things, right? If you know, you know. If you go to the gym and you work out your muscles, you feel soreness in your muscles, right? You feel soreness in your muscles. And you should feel soreness in your muscles equally to both sides or overall. If you feel there's a difference between the two, that's usually the problem. If you feel a heaviness, fatigue, it is not just regular general soreness. That is a whole other problem, right? Don't discount your symptoms and your sensations. You should be able to talk to your therapist, go to a physical therapist, occupational therapist, certified hand therapist, anyone that specializes in the area that you have it. And if they're really good, they should be able to differentiate the words or the symptoms that you're using in order to fully help you get rid of tendinitis. Tendinitis left untreated in certain areas become tendon tears. Tendons are extremely strong. They are meant to do the work for the lifetime of your body as long as you take care of it. Common problems with tendinitis that become tears are in your shoulder. It's just because you have a bone underneath, you have the tendon on top, and you have another bone. And what happens is when things are not moving well, the bones squish that tendon and over time choke it, saw it, and then it tears, right? So that's why after the age of 40, we start to have a little bit more wear and tear. Don't fix it, right? Be stubborn, don't fix it. You're going to find out the hard way in your 50s and 60s when you're trying to get ready for retirement, enjoy time, with the money that you have, your career is taken out, things like that. You're like, oh, I'm gonna plan for retirement, and boom, now you have shoulder pain. They're telling you have to have surgery. You look for surgery, you'll be able to have surgery. You look for it, you get it. But there's ways in which to fix it before, and there's ways to fix it so that even if you have small tears, that you can fully recover without having to have surgery. You just have to be committed to hey, I want to get to the root cause and I want to be able to fix it, right? You don't fix your knee pain, you will eventually have a tendon rupture in your knee. I'm saying this for real because this has happened to a family member of mine. They didn't fix the problem, and they fell and they tore their tendon in their knee. Don't fix your plantar fasciitis. Usually there's a muscle imbalance going somewhere, and you can have all types of other problems in your foot too. Your toes get all gnarly. You have Achilles pain, and that Achilles tendon is tough. It is strong. But people tear it usually from not taking care of tendinitis types of issues. And you tend to hear it more from a sports perspective, but we're not talking about that. We're talking about chronic tendinitises that then lead to other problems. So that's usually what happens. But don't be that person. Fix it when it's, just coming up. Fix it when it's nice and easy to fix. Learn what to do so that anytime it does, come back, you'll know, you have the skills to know how to like start to treat it, and you have maybe built a relationship with your therapist, so then they can come, can come in and look at it and be like, oh, this works. So yeah, let me know if you have any questions, but my link's below if you need my help. Again, my name is Huang with Hands-On Therapy Services, and I appreciate you being here for this long of a video. All right, leave me questions, links below to work with me, and I'll see you on the next video. Thanks, bye.